Hi everyone, I'm Jen Laws, Community Access National Network's HIV, HCV Co-Infection Watch Project Manager and 340B Consultant. In addition to the quarterly watch report, I write the weekly Hepatitis Education, Advocacy, and Leadership blog, covering issues of policy and advocacy impacting our shared communities. While COVID-19's impact on health policy and advocacy is undeniable, we have good reason to believe some of the greatest effects on our particular communities are still ahead of us. Some of these changes and challenges have been the extraordinary moves around telehealth and heightened emphasis on housing as a necessity to healthcare. In March 2020, the National Coalition of STD Directors called for an additional $200 million to expand disease intervention specialists and highlighted these programs having been decimated by funding cuts in the last 20 years. In retrospect, this allocation request was a drop in the bucket. In fact, in March of this year, the organization stated the American Rescue Plan's allocation of $7.7 billion was a step in the right direction and called for a significant portion of that funding to support and hire disease intervention specialists. And they're not wrong. In December 2020, Boston Medical Center released a study showing a massive decrease of HCV screening hospital-wide, and massive as in 50% reduction in screenings, and as a result, a 60% reduction in diagnoses. This isn't isolated. At the Conference of Retroviruses and Opportunistic Infections, the Centers for Disease Control released a report showing a reduction of 700,000 HIV tests and 5,000 new HIV diagnoses from March to September 2020 compared to the same time in 2019. Dr. Todd Ellerin accurately called the decimation of our base information as a surveillance gap. While we've adjusted some, these gaps are precisely the reason why a coordinated effort to achieve the goals of the viral hepatitis, HIV, and sexually transmitted infections national strategic plans in a collaborative, innovative fashion. Now is the time to be bold and brave in our calls to action, and for funders to take risks on funding new and perhaps non-traditional projects. We're never going to overcome the plateaus of the last decade by doing the things the way we've always done them. We certainly won't overcome these new challenges without forging a new frontier in care and advocacy. And that part, the invitation to go big, really big, is exciting. Stay tuned, check in, and watch.